Bring the most up-to-date and accurate information as it concerns these policy positions. Before we get into that, just a recap as to what is happening globally. The COVID-19 spread, unfortunately, has shown no signs of slowing down. The world is recording at this point in time over 600,000 new cases per day. So there has been no decrease in the rate of increase. Globally, there are now 56,111,135 cases. I remember a few months ago talking about 5 million cases, 10 million cases. Now we are at 56 million cases. Deaths, unfortunately, 1,346,693. And our deepest condolences go out to all those families. The number of countries that are recording 1 million cases or above has grown slowly but surely over the past month. We now have 11 countries that have clocked over 1 million cases. And you have 3 countries that, if this present rate of increase goes on, that currently have over 800,000 will be joining that group of 11 countries with over 1 million cases. So that's the global scenario. What is happening locally? The local picture contrasts pretty well with what is happening globally. Our 7-day moving average is about 22 cases per day. These are very good numbers, and I want to thank Team Trinidad and Tobago, all 1.4 million persons across these 2 islands, the majority of whom have been working with the Ministry of Health and have been doing the correct things, wearing of masks, etc. But we still need to get that little minority that is not getting the message, don't appreciate the message, that you need to play your part also, so we can get these numbers down even further. But it has been a great team effort by Trinidad and Tobago, and I congratulate every single one and thank you most sincerely. And the reason for thanking you is that we know that people are fatigued with COVID. COVID fatigue has set in across the world and in Trinidad and Tobago. People want to get back to January 2020, how life used to be in January and February 2020. But right now, that is not entirely possible. And even though we are suffering from COVID fatigue, myself included, we have to continue with the measures. And the next month and a half, as we go into Christmas, where people will be encouraged to gather indoors for Christmas functions, people are planning weddings, big weddings. I'm getting people planning weddings with 300 people. And I want to ask the invitees, even though you get invited, ask yourself, do I really need to go? Do I really need to expose myself in an indoor setting where you will not be wearing masks, not social distancing, whether it's a wedding, a birthday party, anniversary, Christmas party, parang lime? I'm asking persons to protect yourself and to protect your loved ones. The major development that I wanted to speak to the country about this morning is what is happening on the landscape of vaccine development. There have been 2 pretty good pieces of news coming out over the past couple of weeks about vaccine development. The CMO will go into the technical details of that. I will simply be telling you what we are doing from a policy position at the Ministry of Health to prepare ourselves in case one of these vaccines are approved. So let me start off by saying, at this point in time, today is Wednesday, the 18th of November. As we stand today, there is no WHO approved vaccine. What you have are 2 pieces of encouraging news coming out of Pfizer and Moderna. The Moderna vaccine is the one that Trinidad and Tobago should be more concerned about. Sure, I shouldn't use the word concerned about. Should be more in tune with, because the Moderna vaccine is part of the COVAX vaccination program under the auspices of the WHO, of which Trinidad and Tobago is a member. So the Moderna vaccine is a part of the COVAX program. The advantage of the Moderna vaccine, which we look forward to, is that the Moderna vaccine can be stored at much higher temperatures than the Pfizer vaccine. The Pfizer vaccine needs to be stored at -70, -80 degrees, but luckily the Moderna vaccine can be stored at -20 degrees for up to 6 months. So logistically, that is a huge improvement which will make it easier to store and distribute the vaccines. The current thinking and the current research, the current science tells us that once thawed, the Moderna vaccine can be kept at 2 to 8 degrees over a period of 30 days, which is standard operating temperatures for most vaccines that we use in Trinidad and Tobago. So that is good news again. It means that our current distribution from a central repository does not have to change significantly. And it is also stable for 12 hours at room temperature. So these characteristics of the vaccine bodes well for Trinidad and Tobago. What have we been doing to prepare for this vaccine? Because we did not start preparing yesterday or today. Our preparations for vaccine started about 2 months ago. We have set up a team to look at all aspects of vaccine storage and vaccine distribution. So we have our project management unit, which will be handling supply chain logistics and storage. Communications, because we have to launch a communications program. IT, and the reasons why we have to get IT involved is that this vaccine, most likely with the current thinking, CMO could correct me, it's a 2-dose vaccine, 28 days apart. So you get 1 shot today and another shot 28 days later. So we have to be using maybe text messages, phone applications to remind persons when their second dose is. We have set up a team to look at the financing aspect of the vaccine distribution, and under the external program for immunization, they will be responsible for surveillance and distribution. So let's go back. Storage is going to be the critical component because this vaccine has to be stored. Currently, the current thinking is -20. To do that, we have chosen 3 sites in Trinidad and Tobago. 2 in Trinidad. 1, the main hub, will be at the Couva Hospital. That is the current thinking. There was a site visit there yesterday. That will be our main storage and main distribution hub. We will have a redundancy in case something happens at Couva with a small amount of vaccine stored at C40. And we will have a separate storage facility in Tobago. Where are we now with physical capacity to store these vaccines? We are going to have to build at Couva and Tobago separate walk-in chillers. So it's like a big room. In that walk-in chiller, we will be ordering now the ultra cold chain freezers to store the vaccines. These are like your individual refrigerators. So just think about a big room with individual refrigerators stacked up inside it. So those individual ultra low temperature freezers, we already know the volumes. We will be ordering somewhere between 5, 8, or 10. We will make that final decision this week because we have to talk to PAHO to find out in what possible volumes and quantities we'll be getting the vaccines. So you're going to have a main storage hub, a walk-in chiller. Inside that walk-in chiller, you will have the individual ultra-low temperature freezers to keep the vaccines at -20. We also have to build into that now a step-down room and a prep room. So the prep room is where the persons handling the vaccines have to don their warm clothing, coats, hats, and so on. They will go in, take out the vaccines, and then you take it out from the ultra-low temperature chillers into a sort of step-down room where the thawing process may start. It does not have to be at -20 all the time because, as I indicated earlier, let me just repeat, it is stable at between 2 to 8 degrees for 30 days. So, and then they go into the individual coolers as per usual, like we use for the flu vaccines, and distributed. And we are now working out and have already worked out to some degree how we will actually distribute these vaccines, what will be the sites, and so on. With this vaccination plan, there is going to have to be a robust communication program, as I said earlier, because we want to alert the population, because we're already getting some feedback that people are misinterpreting the current flu vaccination as the COVID vaccination. 1 or 2 people are saying that when they get the flu vaccination, that they have gotten the COVID vaccination. There is no COVID vaccination approved anywhere in the world right now, including Trinidad and Tobago. What we are giving out now is the seasonal flu vaccination. And I use the word seasonal in reference to Prior Bihari. I see Prior laughing there. It's the seasonal flu vaccine we are giving out now. So we are going to have to launch a very robust communication plan. So ladies and gentlemen, that is where we are right now with the Moderna vaccine. Let me just recap. It is part of the COVAX facility. Trinidad and Tobago is a part of the COVAX facility. We now have the physical characteristics of the vaccine. So the plans we have been looking at for the past month can now be put in place to build out the facilities in Cuba, in Tobago. C40 already has a walk-in chiller. All we have to put into C40 is one ultra-low temperature freezer. So we're going to have 3 sites around both islands to store the Moderna vaccine once it is made available to Trinidad and Tobago. So that's my update on where we are with vaccines in Trinidad and Tobago. Thank you very much, Al.
Thank you, Minister. We will move straight into the clinical update with Dr. Parasram.
Hi, thanks, Al. Honorable Minister, Dr. Nandram, members of the media, members of the viewing and listening public. So I'll give the update as of 4 p.m. Tuesday, the 17th of November. The number of tests done in the public sector, 35,154. Total tests done in the private sector, 23,804, giving a total of 58,958. Of those, since the 12th of March, we have 6,135 being positive, and total recovered patients, 5,460, giving us an active caseload of 563, with 112 deaths up to present. In terms of the number of cases over the last 24 hours, we had 39 persons, and 37 people remain in hospital at various facilities. In step-down facilities, we have 25. In quarantine sites, 212. And total persons in home isolation are 462. By way of the hospital breakdown, we have 37 people, as I said. At the Cuba Hospital and Multi-Training Facility, there are 25 persons. 3 persons in the ICU, 2 in the high dependency unit. At Cora, 11 persons, and at the St. Anne's Hospital, 1 individual. With regards to our step-down, our Claxton Bay Correctional Facility, there are 18 persons who actually came from the prison system. The UE Debe site, there's 7 persons. There's no one in Tobago at this time. With regards to our quarantine repatriation process, we have a total of 212 persons. At the Chancellor Hotel, 11 persons. Cascadia, 37. Home of Football, 38. Regent Star, 31. Debe Halls, 2. UE Canada Hall, 26. UE Freedom Hall, 32. And at the Cape Park Hotel, 35 persons. If we could go quickly to my first slide, please. So basically, I just wanted to give a little idea of where the active cases in the community are spread throughout the country by county. So if you, the little note on top says Tobago currently has no active cases, which is very good. If we go from highest to lowest in terms of percentage, right now St. George East has now got the highest percent at 19.8. Then we follow that with, I think, County St. George Central, which is 17.8%. Victoria at 17.5. County Carney, 15.1. Then we have, following that one, St. George West, 8.6. St. Patrick at 6.0. Nariva Mayaro, 2.6. And this is out of a total of 462. If we could go to the next slide. Yeah, so this just tells you, in terms of their clinical disposition, we break them down into different categories. So we have asymptomatic people accounting for 60.2% of the people in home isolation at this time. 26.7% are symptomatic, mildly so. 4.2% have been transferred to facilities. There have been 4.2% of those recovering over the last 24-hour period, and new cases 4.7%. Next slide. This one just basically gives you a female to male ratio, more or less the same. It's in this slide it shows a slight predominance of females, about 52% versus 48%. Next slide, which gives us our comorbidities. Again, diabetes accounting for 24.5%, hypertension 29.5%, heart disease 4.3%, pulmonary issues 2.9%, pregnant patients 3.6% of those, and asthma 10.8%. Other, meaning other comorbidities in general, are 24.5%. My last slide. So the last slide is sort of a pictorial map of Trinidad and Tobago. So if you look at it as a glance, what it's meant to do is basically give you, we're starting at that light yellow color, which is no cases, and we break it down, those lines that go across. You see dark black lines which give us the boundaries of the counties, and the lighter lines which go between give us our community boundaries. In between, the color goes from yellow all the way up to a dark red. The darker the color, of course, the higher the level of cases. So at a glance you could look at it and spot on the map where are the areas of concern, so that we target our public health measures as well as our communication strategies. Yeah, that's my final slide. I just touched briefly on what Minister started with regards to the vaccine type. I know there have been a lot of talk about the mRNA type vaccine. So just to break into what the vaccines are normally, how the technology is currently in development, there are 4 main subtypes, which are the viral vector subtype, which is viruses that have been engineered to carry DNA into cells. There's the nucleic acid type, which is broken into DNA, and mRNA type. The 2 vaccines that Minister would have spoken about are the mRNA subtype. It's really a messenger RNA containing a sequence from the antigen of COVID-19 that will go into cells and cause those cells to actually create antigens, and then of course you get antibody responses from them. There are protein-based types, which are purified or recombinant proteinaceous antigens, which go into cells, and are usually taken from a COVID-19 cell as well. Or they can be inactivated, complete COVID-19 particles or portions of those, which are inactivated by some means, whether chemical or otherwise, and they're placed in the body by vaccine to get to mount an immune response. So that's my clinical update for this morning.
Thank you, CMO. Dr. Nandram will now provide us with an update on antigen testing for COVID-19 and just what this method of testing means for you, the public.
Thank you, Mr. Alexander, Honourable Minister, Dr. Parasram, members of the media and the viewing public. In the Ministry's continued fight to move Trinidad and Tobago from community spread back to cluster spread, the Ministry is in the process of introducing COVID-19 antigen testing on a phased basis. This is a very important step in managing COVID-19 because it allows us to identify very quickly positive cases under certain settings, such as accident and emergency room departments. The PCR testing does remain the gold standard. However, there are several advantages to antigen testing, and these include the fact that it's a lot cheaper, and the results are available a lot quicker, and in so doing, management of the patient can be expedited. The introduction of the antigen testing, as with the introduction of all new tests, requires a certain degree of diligence and due caution, and it's for that reason that the validation of the test is ongoing. If I could have the first slide, please. So just to put this into our minds again, the Ministry of Health procured 15 machines and 150,000 test cartridges for the SD Biosensor Standard F. So this is the antigen testing machine that we'll be placing on a phased basis into, first of all, in phase 1, the general hospitals in all regional health authorities, and then subsequent to that, during phase 2, district health facilities, and I'll speak a little bit about the specifics of which facilities in a subsequent slide. The interesting thing about these machines is that they can produce results while the patient is still at the facility in a single visit. And the results can be produced in a printed format that we can include in a file, and it can also be digitally output into a lab information system. May I have the second slide, please? In addition to the standard F, we also have the standard Q, which is a pregnancy-style cartridge. We've ordered 40,000 of these test cartridges, and we hope to deploy them in smaller health facilities, rural areas, use them for outreach programs, and again, these can produce results within a single visit. May I have the next slide, please? In phase 1 of the antigen testing rollout, we intend to deploy the F2000 in every major hospital in the RHA, every general hospital. So for North Central, we're looking at Port of Spain General. For Northwest, Port of Spain General, at North Central, at Eric Williams, Southwest, at the San Fernando General Hospital, at Eastern Regional Health Authority, the Sandy Grande General Hospital, and in Tobago, the Scarborough General Hospital. During the phase 2 of the rollout program, we'll be deploying at district health facilities in all these RHAs. May I have the next slide, please? So, I'd like to speak quickly on why it's so important to examine the test performance. Why is it so important that the Ministry of Health validates the test before we roll out the machine? Why couldn't we just simply put the machine down and start testing everyone? Well, there are a couple very important reasons for that, and the chief among them is to ensure the safety of staff and the safety of the public. So I'll just go into just a few things as to why it's important. So the first reason is that we need to confirm the manufacturer's claims, to verify the claims of the performance of this test, and that will ensure that we can rely on the results of this test. It also helps us identify within our local setting the requirements for this test, the conditions under which this test performs at its best, and that we can rely on the results. For example, how long after symptoms start can we use this test? Can this test be used with persons that have no symptoms at all? These are the kind of questions that we're examining during this verification process. And this will also help us identify the limitations of use. And all tests have limitations. So the verification process will help us ensure that once these tests are used, we can rely on the results of these tests. So it really helps guide us in the use of in the clinical setting, and ultimately it will ensure the safety of the staff and the public. And as with the introduction of all new tests, this process takes a bit of time. So thus far I can report that we have done some core training with the manufacturer. The pre-verification process has already started, and within the next few weeks, we anticipate that these machines will be installed in all the general hospitals, this mentioned previously, and the training for the relevant staff will be complete and the verification process can get underway. All right. That ends my contribution for today. Mr. Alexander, I hand over to you.
Thank you, Dr. Nandram. Next on the agenda is the question and answer segment. We remind our media representatives to state your name and the name of the media house that you represent before asking no more than 2 brief questions. We'd also like that both questions be asked at the same time. Today we begin the Q&A with questions from CNC3.
Hi, morning everyone. Rashad Khan, Guardian Media. Nice to see you in front of the camera, Al. Okay, so my 2 questions are really to Minister. We spoke about vaccines, and I know it's still in a very early stage, but can you say if we have any intentions to put things in place to receive vaccine outside of the COVAX facility? And my second question is, Minister, when do you think that we could probably start putting some of these things in place that you mentioned for the Moderna vaccine, such as the chillers and that kind of stuff, and how are we going to fund it?
Thank you. So your first question, just repeat your first question, please.
The first question?
Yes, just repeat your first one.
Hello?
Yeah. Your first question was, when are we going to start to put things in place to receive the vaccines?
No, the first question that I asked was if we have any intentions to reach out or put other things in place to receive vaccines outside of the COVAX facility.
Yeah. Okay, thanks. So at this point in time, everything I say is at this point in time. At this point in time, we are married and we are wed to the COVAX facility at this point in time. So we have no intention at this point in time of reaching out outside of COVAX. Funding, we have already paid into the COVAX facility $1.477 million as part of our commitment. All countries that are part of COVAX had to pay in a certain, let's say, down payment. That down payment was utilized by the COVAX facility to fund research and development across the different candidate vaccines. So Moderna would have been given some of that by some formula that Gavi would have worked out. The logistics, as I said, I gave you a full breakdown of where we are now with logistics. We had planned for it, but it's only this week we know the temperature range, so we could not predict the temperature range beforehand. Now that we know the temperature range, as I have said, we have now accelerated the plans which we had on paper to build out the chillers, to order the ultra cold freezers and so on. So that is currently being done now that we know the physical characteristics of the vaccine. So I hope that answers your 2 questions, Richard.
Thank you very much. We go next to AZP News.
Hi, good morning. Priya Bihari, azpnews.com. Good morning, Minister. Good morning, doctors. Nice to see you, Al. My first question has to do with the prison. AZP News has been told that prisoners who are tested for COVID-19, when they are tested and awaiting results, they are taken back into the general population. And also people who are prisoners who are positive are also taken in the general population. My question is has the advice from the ministry been that a prisoner who is tested and waiting results, should he be self-isolated? That's my first question. And my second one has to do with the Hunters Association is having a peaceful rally today, asking that the hunting season be open, because they are saying that hunting takes place in groups of 6 and 7, that all of the protocols can be observed just as in hiking, which is allowed, and just as things happen in the gym. And so they wanted to know if the ministry is considering opening back the hunting season. Thank you.
So I will take the second question first. So we appreciate every interest group's desire to be normal, and I said so. We are all suffering. We are all suffering from COVID fatigue. We are all suffering from COVID fatigue in Trinidad, the Caribbean, and the entire world. Every time I am asked at these press conferences, would I consider this? I will always say, we have to be careful about making up policies on the hoof. It is something that will be considered, and we will look at it as we consider the safety of the entire country. So I can't give you a definite answer, yea or nay, right now. Thank you very much. CMO.
Okay. Right. So prior, there was a press release that was issued from the Corporate Communication Unit of the prisons, and I could read from it. Basically, to answer your question, it says, the prison system has built out a parallel system for inmates who test positive, and also for those who may be primary contacts. That's the ones that would have been tested as well. This system has been in place for some time now. Prisons are working closely with the Ministry of Health, and I would add that is through the Office of the CMOH for St. George East, to isolate inmates and to treat those who have tested positive, and the prison is taking precautions and situation is being monitored closely. What we have from my County Medical Officer of Health for St. George East is that so far we have a total of 88 persons out of the prison, which includes officers and inmates that have tested positive. They have been well isolated from the reports that I have from my CMOH, and all precautions are being taken. We're working closely with the prisons in that regard. Thanks, Al.
Thank you, CMO. We now go to 98.1.
And a very good morning to the panel, Mr. Alexander and Minister Dayal Singh, CMO, and of course Dr. Nandram. Stephen Cummings, 98.1 FM. My two questions are quickly, one for Minister Dayal Singh and the other for Dr. Parasuram. I'll start with Dr. Parasuram. Dr. Parasuram, is the use of extracorporeal membrane oxygenation technology part of our treatment of severely ill COVID-19 patients? Now, apparently, this procedure, I'm told, was used by a doctor in Sudan, which with much patient success, restoring patients' ability to breathe freely and independently. And Minister Dayal Singh, on a policy note though, we have yet seen another case of someone breaking quarantine, finding their way to a gym. We have tried moral suasion and, of course, the use of the police service. Could electronic tagging be of any added comfort to, in terms of a policy, going forward for persons who may, want to venture outside of the prescribed legal provision? Thank you.
Okay, so I'll take the second question first. On the issue of electronic tagging, yes, it is something being actively looked at. However, because of our written constitution, the Attorney General has advised that this will have to be done on a voluntary basis. We cannot compel someone to wear an electronic tag. So if and when we do implement the electronic tagging system, it will be done on a voluntary basis, because we do have a constitution that guarantees certain rights and freedoms, but it is being actively pursued via PAHO and other agencies. But it's something that is to be considered. Thank you very much.
Thank you, Minister. Express, you are next.
So,
no,
I think that was a question.
Sorry.
So in terms of extracorporeal membrane oxygenation, basically what it is a sort of heart-lung machine that sits outside someone's body, similar to the principles of dialysis, where you have the blood pumping out of your system, it goes through the machine, receives oxygenation, and then it goes back in. So in principle, it is a supportive sort of care. It is not a treatment option per se, but it is supportive and has been used in other parts of the world. But with regards to treatment and specific treatment for COVID-19, there's no specific treatment that has been recommended as yet. The WHO Solidarity trial is ongoing in Trinidad. We are in the process, I believe, from my last update from UE, of beginning shortly with actual asking patients to volunteer into that program, but there still remains no specific treatment for COVID-19.
Thank you. We now go to Express. Express, we're waiting for your questions.
Good morning, Camille Hunt, Express.
Yes.
Minister Dialsingh, yesterday you spoke about an individual from Point Fortin who breached his quarantine and he went to a gym. Can you share any further details about that regarding contact tracing and how many people may have been exposed from that individual's actions? And are you satisfied that the monitoring system in place is sufficient enough to prevent situations like this going forward?
Yeah. Okay, thank you, Camille. Excellent question. As I said in the Senate, and you would appreciate, no system that involves people is going to be 100% accurate. And I did say in the Senate yesterday, this was the exception rather than the rule. So it doesn't mean that because one person broke quarantine, that the system isn't working. Individuals have to take a lot of personal responsibility. And on the news last night, you did have a senior police officer, I forgot his name, and I empathize with him, who said big people, you know, the police shouldn't have to be going after big people to do the right thing. So this was an exceptional case, which I said in the Senate yesterday, but by and large, for the vast majority of cases, the system of home quarantine is working very, very well, and I will ask the CMO to talk about the other part of the question.
Yeah, so in terms of contacts, what we have done is in the gyms, following the protocols that we developed, there is supposed to be a logbook which says who comes to the gym, they have their address, they have their phone contacts. So through that mechanism, we were able to determine how many times that particular individual would have visited that gym, and we would have been able to get the contact information for all of those persons. They would have been deemed a contact and followed up by the CMOH office to ensure that they had no symptoms. Of course, if they develop symptoms, they would be tested as the need be. I am told that the person in question was asymptomatic during the times of the visit, which is good. In terms of spread of disease, the likelihood would be a little bit less, but we still follow them up for the entire 14-day period, and that is being done through the CMOH in Victoria.
Thank you, CMO. We now go to Tobago Channel 5.
Hi, good morning. Candace Jackson from Tobago Channel 5 News. My question is in regards to, Tobago going to be into another round of elections. Well, we already are in another round of elections with the dissolving of the House yesterday. But what are some of the advice that we can be given to candidates this time around that we can do things a bit differently so that we don't have some of the same spikes that we saw in August after the general election?
All right, thank you very much, Candace. Excellent question. So we urge people again to follow the simple public health measures. Wear your mask, social distancing, everybody walk with a sanitizer, don't congregate in crowds. You see, congregation in a setting where you can't wear a mask, can't social distance, is the best advice we could give in an election season or out of an election season. In a wedding, in a christening, the same principles apply. But the bigger the crowd, the more you need to adhere to the public health measures. I don't know if CMO wants to add anything, but the EBC, as they did for the general election, did have a set of guidelines. So I'm hoping that our friends in Tobago follow the guidelines. Thank you very much.
Very important advice. We go now to TTT.
Yes, hi, good morning. Sonolala from TTT News. Minister and CMO, I think you mentioned that the Moderna vaccine is a 2-dose vaccine, one on the first day and the 28th day. What would happen if, I know it's early days yet, but what would happen if someone misses that 28th day? Is there a specific time period that the second vaccine can be taken?
Okay, so as you rightly said, Sonal, it is early days yet. We just don't have that type of data as yet. It is very early days for all these technical questions, but we must ask, because these are the questions we are asking when we get the data to look at whether a vaccine is safe and effective and so on. But we do have some experience in Trinidad and Tobago, and the CMO will go into more details about the MMR vaccine, mumps, rubella, and measles, which is given, I believe, 6 months apart, or 2 years?
1 year.
So, and he would talk about how the effectiveness decreases if you don't take your second booster shot. So CMO.
Yeah, so MMR is one example where you have a vaccine that is supposed to be given at specific intervals of time apart, right? There are other vaccines, DPT, oral polio, which have to be given, again, a specified period. So what happens, you get your first dose, you produce antibodies up to a certain level. The second dose is called a booster dose. So it boosts your, basically it does exactly that. It boosts your immune response and causes the generation of a greater number of antibodies, increasing your protection against infection from that particular pathogen. So what happens with MMR, for example, if you miss your dose at the specified time, we give it to you at a later time, we reach out to you. So more than likely, if someone misses it by a week or two, it will be given, and there should not be a great impact on your general immunity. But again, as Minister said, this is a new vaccine, it's a new disease. We're not sure how long the immunity will last, generally speaking. We have other vaccines, for example, yellow fever, which years ago we were giving boosters, and then there was research that was done going back 20 years that showed once you have one vaccine, you have immunity for life. So it varies across the spectrum of disease. We have to look at COVID-19, look at the new vaccine, see what is recommended by the manufacturer and WHO, and then we'll be guided accordingly.
Thank you, CMO. TV6, you may now ask your questions.
Gentlemen, calling from TV6. I'd like to find out a little bit more about the prison outbreak. Just following up on Prior's question, is being classified as an outbreak? Is it medically? So one, and also there was the Center for the Caribbean Center for Human Rights, and they talked about the prison conditions. Their concern is that whereas some measures have been put in place, those measures are not consistent with the WHO's regulations. I'd like to find out if the Ministry of Health visited the facility to find out about the general condition, and if you all are pleased. My second question, Dr. Parasram, you would have talked about the underlying question, the underlying conditions for persons who I think died from COVID-19. I'm not sure if it's just general persons who had COVID-19, diabetes, hypertension, heart disease, etc. But was there a category for overlap where some of these symptoms would have overlapped, and would that have contributed to the person being probably more severe? One. And two, there's a lot of writing about obesity being a factor. Is that so? And particularly in Trinidad and Tobago, where I saw there was a report a few years ago saying that we had high levels of obesity here. Thank you.
Okay, so I think that's more than two questions, but I'll try my best. All right, okay, so yes, it is an outbreak. Once you have an environment that is somewhat sterile, so we treat the prison as a separate entity away from the general population, and as per their press release, they have indicated they have put measures in place early on, I think as early as February or March, so that we can actually isolate that population as best as they can, decrease visitations, those kinds of measures they had put in place to treat it as a separate population. Having no cases in that environment, of course, 1 or 2 cases will signal an outbreak in that particular environment. They have now 84. So if you take it as an isolated area, it is an outbreak in the prisons. So it's considered an outbreak. There is oversight from the CMOH Office of St. George East, as well as the North Central Regional Health Authority, because those two areas have jurisdiction over the prisons in Golden Grove. However, we are a supporting entity. We support the prisons system. We would give technical advice. We do visitations from time to time, and that this situation would have been no different. So we will support them as best as we can. In terms of your pregnancy-related question, sorry, the overlap, there is overlap. So for example, when we gave 25% diabetes, 28% hypertension, there are people that of course will have hypertension and diabetes, which may send up their risk in terms of, there's no documented evidence in Trinidad at least that suggests having more than one comorbidity increases your risk exponentially, one greater than the other. And in terms of your last question, obesity has been classified worldwide, I think, as a risk factor for COVID-19 in some territories. And we have seen that obesity can be a risk factor for mortality and morbidity in Trinidad as well.
CMO, if I remember correctly, because Urvashi has touched on something very very important. She was asking about the overlap with diabetes and hypertension. You may recall yesterday, you, myself, and Dr. Hines were looking at these figures, and correct me if I'm wrong. I think we concluded that 31% of the fatalities had overlap between diabetes and hypertension. So Urvashi, 31% had overlap between diabetes and hypertension together. So that's a very important question you asked, and I want to thank you for bringing it to the country's attention.
Thank you, Minister. IETV, you're next.
Hi, good morning, everyone. Binima here from IETV News. I have two quick questions. My first question, either for the Minister or Dr. Nanram, given that we have received additional antigen testing kits, can we expect to see a change in the testing policy, meaning that more kits equals to more testing with persons with less symptoms? And my second question would go to the CMO. Dr. Parasram, you mentioned in one of your slides, there was a red area somewhere northeast Trinidad or north central Trinidad. It was an area, and you said that area was a cause for concern. Can you elaborate on that area, please? As well as, obviously, there's a concentrated amount of cases there. Based on contact tracing, what would have led to the increase in the cases? Thank you.
Okay, so I don't know, in terms of your question related to the map, I believe there are a few red areas. Yes, there's one in the county of St. Andrew, St. David, which is really around the Sandy Grande area. There was a cluster of diseases that we noted in the Sandy Grande area in particular, which has been from the CMOH office in that particular county. We have tracked more than, I would say, a significant proportion of the contacts, and we have seen a reduction in the size of that cluster over the last 2 or 3 weeks. So it gives an indication that the contact tracing is being done successfully in that particular area. There are other areas in St. George Central and Victoria where we're seeing clustering as well, but that large cluster in Sandy Grande has decreased significantly over the last 2 to 3 weeks based on the contact tracing. In terms of your first question, I don't know if Dr. Nanjam will add, but generally speaking, the tests that we have procured are from the manufacturer's side are best used for persons that have symptoms. So if you want to use it on persons that don't have symptoms, it drops the sensitivity of that particular test, and they have strongly advised that we use it for persons that have symptoms, which aligns to the national policy. So we expect that our policy will continue in its present form. Using those tests will give us the additional benefit of having very quick turnaround times in terms of from the time a sample is taken to the time you get the results can be as little as 30 to 40 minutes in some instances. So it will turn around the test time quickly so we can deal with suspected categories very quickly. We may not need to have separate holding bays for persons that have suspected disease. Those sorts of benefits. I don't know if Dr. Nandram, you want to add anything?
Well, just to quickly add to CMO's contribution, the Ministry of Health, since establishing its local testing capacity, has always had a very welcoming approach to testing. And as CMO voiced, as long as the person's symptomatic, we'll test them. And this is just simply another modality of testing, and the main advantage being, the first is that it's a lot cheaper than PCR testing, so there's that economic advantage. But in terms of logistics and a practical advantage, it affords someone a result within a single visit, and that speeds up the process and you know, helps us logistically in that we don't have to house patients while pending results, hopefully going forward. Thank you so much.
Let me just complete the answer, because Bina, you asked a very important question about St. Andrew, St. David, Sangre Grande. You may recall, or you may not, Dr. Alana Best, who was the CMOH for that area, was here about a month ago, a month and a half ago, when this cluster of cases in Sangre Grande first came out. And she indicated there was one person who was ill, symptomatic, and went to work and infected 41 persons. And that is why we keep telling people, if you are ill, stay home. She also said in Sangre Grande, there was a birthday party for an elderly gentleman. I remember that distinctly. And out of that birthday party spawned a number of cases. So we have to keep on urging the population at this time of Christmas especially to avoid the Christmas gatherings. In some countries around the world, their current phase of exponential growth of COVID cases is now being driven by indoor gatherings, Thanksgiving dinners. That is what is driving it in some countries now. And we are concerned at the Ministry of Health that in January, and I'm saying it now, that in January we could see the results of indoor gatherings where people have weddings, Christmas parties, Christmas limes, where the public health measures cannot be maintained. Wearing of masks, social distancing. So we are urging people, avoid hosting large indoor gatherings, limited to your own bubbles, and people who are invited to indoor gatherings, think twice, think 3 times. Ask yourself, is that a risk worth taking right now? Okay, thank you very much.
Thank you very much, Minister. We go quickly to Wired 868. Wired 868, we are waiting for you. We can't hear you.
Hi, good morning. Is everyone hearing me?
We're hearing you now.
Hi, I have a quick question for the Minister. When you're talking about the plans to distribute the vaccine, when we do have it, could you tell me if the plan is to inoculate the entire population or if there will be priority groups?
Okay.
That's my first question. And my second question is with regards to the prisoners. Back in April, the Attorney General had mentioned that there were 388 prisoners who were identified for proposed release. Do we know if that actually happened? And given the outbreak of COVID-19 in prisons now, would we be looking to do another release like that?
Okay. So thank you, Fiola, for that most important question. So under the COVAX facility, and even the same policies for flu vaccination, you don't vaccinate the entire population at the same time. What you do, you prioritize. So for the COVAX vaccines, just like the flu vaccines, the first groups of people that will be prioritized will be 1, all frontline workers, inclusive of healthcare workers, inclusive of sanitation workers, police, Army, Coast Guard, anybody on the front line, inclusive of healthcare workers. Whilst you are doing that, the second group that you try to vaccinate will be those that bear the brunt of mortality. That is the elderly, typically over 60, 65, with comorbidities. After you do that, or whilst you are doing that, you also target the immunocompromised regardless of age. So you have a young cancer patient with leukemia 5 years, or a 45-year-old cancer patient, regardless of age, but you are immunocompromised, you will be first in line for the vaccines. After we finish those 3 major groups, then we start to work ourselves down the order of priority into the general population. But there is no plan to vaccinate 1.4 million people. What we have signed up for and been advised by COVAX is this. In the first instance, okay, let me go back in time. The cabinet note and what we have signed up for is to vaccinate 33% of the population, which is roughly about 464,000 people. But in the first phase of vaccinations, under the COVAX facility, you will get vaccines to vaccinate 20% of your population. In that 20% will be the categories I spoke about: frontline workers, elderly, immunocompromised, and so on. When we are through vaccinating in phase 1 those categories, then we will receive the additional vaccines to vaccinate at least 33% of the population. So that, as we stand now, is the vaccination distribution policy that we have signed off for with COVAX, which bears markedly, it is markedly similar to the same protocols we use for the seasonal flu vaccine program. Thank you very much.
Regarding prisoners?
Oh, prisoners.
No, this is the release. I don't know.
So the CMO read the release already about the prisoner issue.
Okay. We go quickly to Express with the limited time that we have. Okay, Express. Okay, so we'll move to CNC3.
Hi, morning, Minister. Really quickly, I think you may have misunderstood what I asked before, and I'll take responsibility for that. But what I meant was you identified a number of things that has to be put in place, such as the chillers and whatnot in the Couva facility. So I want to know if you all have an estimate of how much that would cost us right now, and if you have sufficient funding to be able to carry that out through your budget allocation.
Okay, sorry, Rashad, I misunderstood. It's not your fault. So we are now working out those estimates, Rashad, because we only now know the temperatures that we have to work with. So site visits were done yesterday to Couva. We have worked out dimensions. Now we have to go out to get quotes and so on. But my information is the chiller, the walk-in part, could be built very quickly, and we will be ordering the standalone sub-zero freezers simultaneously. So things will be done simultaneously, and yes, the funding is there to do that. Thank you very much, Rashad. And I'm sorry I misunderstood the question.
Ladies and gentlemen, we have come to the end of today's media conference. Thank you everyone for your participation. As you enter the Christmas season, please protect yourself and your loved ones. Remember to adhere to the simple guidelines that we at the Ministry of Health continue to reinforce. Maintain at least 6 feet physical distance from others. Wash and sanitize your hands and clean frequently touched surfaces. And don't make them ask. Wear your mask.